So hospital systems should really be thinking about home-based medical care for a few reasons. Number one is that many of them have become accountable care organizations. So in that context, people who live in their vicinity, who are homebound, will end up being attributed to their accountable care organization, whether they like it or not. And in that setting, people who are homebound are, if they're not being well tended to, if they're not being cared for through home-based primary care, through home-based palliative care, are likely to end up being very high-need, high-cost patients for them. So they'll actually end up costing them money, which will make their ACO not look like it's performing all that well. So in the context of an ACO, you want to be reducing costs. And in truth, you can only reduce costs on people who cost money. You can only save money on people who cost money. So these are people on whom you can actually save money. So it should be an attractive target for an ACO. In the context of a hospital that's not part of an ACO, home-based medical care is simply good and better care than typical care. Because it does provide access to medical services for people who would otherwise only have access through usually the emergency medical system, through calling 911. So if a hospital system is operating above capacity, you may not want all your beds filled with old, frail Medicare patients. You might want to do a better job and keep these patients out of the hospital. Home-based medical care allows you to do that. In addition, if you have a good home-based medical care program, you're capturing these patients for other services in your medical center, which could be of benefit to a health system.